New tonight, a slow goodbye. That is how a quintessential Colorado husband and father is referring to his ALS diagnosis.
ALS is also known as Lou Gehrig's disease. The incurable neurodegenerative disease kills more than 5,000 Americans every year. And tonight, Tom Pringle wants to be more than another statistic. He wants to make a difference. He sat down with your investigator, Brian Moss. Brian joins us now. So how does he hope to make a difference, Brian?
What he wants to do is he wants to try an experimental drug, which is something you can do under Colorado's right to try law. That allows people who are facing fatal illnesses to try out drugs that have not been approved yet for human use. But Tom Pringle has run into an unexpected roadblock: his own doctors.
Within 90 days of symptom onset, our daughter Olivia lost the ability to walk. She lost the ability to talk.
The stories are heartbreaking.
It felt unreal, like this can't be happening to us.
Most patients pass away in their mid-20s, and so being 15, I thought about I could be dead in the next 10 years. You know, that's crazy to think about.
And compelling.
Since I don't have any other option, might as well give it a shot just to see what happens. Worst case scenario, I die early. Best case scenario, I survive.
Americans facing life-threatening illnesses allowed to try experimental drugs that might save their lives under what are known as right-to-try laws.
It's very difficult to watch as your body melts away. It's a slow goodbye.
At 71 years old, Tom Pringle knows exactly what is coming. So what's important to you in life?
Family and faith. I'm not afraid to die. God's got me.
Tom and Patty have been married for 51 years.
Well, the photo shoot, we had to be out on the wet sand, and we really noticed at that time he was having a little bit of problem with balance.
For most of Tom's life, he's been defined by motion, athletic, an outdoorsman, a lifelong Buffs football fan. About a year ago, a doctor diagnosed him with ALS. The disease will rob Tom of his ability to move, then speak, then breathe. There's no cure. Tom remembers being with Patty after getting the news.
We were sitting in the parking lot. It was like a kick in the gut, and it was pretty emotional for a while. And then we decided, well, we're just going to do what we can until we can't, and we just keep going.
Then last year, in what seems like a 1 in a million shot, Tom shared his diagnosis with Brad Duft, who went to high school with Tom's wife. It turns out Duft is a patent attorney in the biotech industry who helped develop a drug called tenabrasat. It's not FDA approved, but tenabrasat has shown promise in ALS studies on mice.
Boy, if we can get him this drug under our right to try laws, that would be terrific.
Hi, Dad.
Hello.
I think he sees the promise and the hope. ALS patients have no hope and no promise other than to dwindle and die.
Elevator go up.
To find out if it has any effect. And if it has an effect for me, then it obviously would have an effect for other people with ALS.
With this glimmer of hope, Tom approached his medical team at UC Health, as the right to try law says the patient's treating physician has to be on board. His medical team's response came in this email from a nurse. They all agree that right to try does not obligate them to provide the necessary time, monitoring, and paperwork that would be required by them. They also do not believe that the drug would offer any help based on the data available so far.
It's frustrating to know that there's a drug right there that we could try and find out if it does anything or not. And that's really all I want to do, is find out if it does anything or not for me or possibly other people.
It allows for these individuals who don't have any other options to have another option.
Colorado State Representative Lindsay Gilchrist was one of the sponsors of Colorado's Right to Try law. She says she feels terrible for Tom, but the law does not require doctors to go along with their patients' wishes. He needs to find another doctor is what he needs to do.
Under the Right to Try law, again, voluntary needs to be in consultation with your physician. So the way to move forward with an experimental treatment is to find a physician that would do that.
This is not going to work.
But for a patient in Tom's situation, that's easier said than done.
Give me a paragraph or two on ALS and tenebraset.
Tom is still working, selling real estate.
Tom Pringle, Remax Alliance. Just wanted to give you a call, see how you're doing. Let me know if you have any questions. Take care. Bye-bye.
Trying to manage his day-to-day care and well-being. So searching for another doctor willing to sign off on trying tenebraset is a tall order.
Not really a Hail Mary. I don't ask, why me? I just say, what can we do with this? Don't feel sorry for me. Just give me an opportunity to see if this drug works.
In a written statement, UC Health says it deeply empathizes with patients facing life-altering diagnoses and supports the Right to Try law. But the hospital noted doctors are not required to recommend an investigational drug, especially if the physician does not believe that the treatment would be beneficial to the patient based on available research and data. It's important to note that Right to Try laws basically do exempt treating physicians from legal liability as long as they exercise reasonable care. And we should also note, Michael and Karen, that Tom did say that he loves his UC Health doctors. He just doesn't agree with their opposition and their decision about letting him try tenebraset.
And you can't help but feel for Tom and his family as they go through this. Thanks, Brian.